Administering medication through subcutaneous injections. Gather the equipment. Check medication order against the original physician's order according to agency policy. Clarify any inconsistencies and check the patient's chart for allergies. Know the actions, special nursing considerations, safe dose ranges, purpose of administration, and adverse effect of the medication to be administered. Consider the appropriateness of the medication for the patient. Perform hand hygiene. Move the medication cart to the outside of the patient's room or prepare for administration in the medication area. Prepare medications for one patient at a time. Read the medication administration record and select the proper medication from the patient's medication drawer or unit stack. Compare the label with the MAR. Check the expiration dates and perform calculations if necessary. If necessary, withdraw medication from an ampule or vial as described in the previous skills. When all the medication for one patient had been prepared, recheck the label with the MAR before taking them to the patient. Lock the medication cart before leaving it. Transport the medications to the patient's bedside carefully and keep the medications in sight at all times. Ensure that the patient receives the medication at the correct time. Identify the patient using the 3 methods and compare information with the MAR. Check the name and identification number on the patient's identification band. Ask the patient to state his or her name. If the patient cannot identify him or herself, verify the patient's identification with the staff member who knows the patient for the second source. Close the door to the room or pull the bedside curtain. Complete necessary assessments before administering medications. Check allergy bracelet or ask patient about allergies. Explain the purpose of the medication to the patient. Perform hand hygiene and put on gloves. Select an appropriate administration site. Assist the patient to the appropriate position for the site chosen. Drape as needed to expose only the area of site to be used. Identify the appropriate landmarks for the site chosen. Clean the site with an antimicrobial swab while wiping with a firm circular motion and moving outward from the injection site. Allow the skin to dry. Remove the needle cap with the non-dominant hand by pulling it straight off. Grasp and bunch the area surrounding the injection site or spread the skin taut at the site. Hold the syringe in the dominant hand between the thumb and forefinger. Inject the needle quickly at a 45 to 90 degree angle. After the needle is in place, release the tissue. If you have a large skin fold pinch up, ensure that the needle stays in place as the skin is released. Immediately move your dominant hand to steady the lower end of the plunger. Avoid moving the syringe. Inject the medication slowly at a rate of 10 seconds per milliliter. Withdraw the needle quickly at the same angle at which it was inserted, while supporting the surrounding tissue with your non-dominant hand. Using a gauze, apply gentle pressure to the site after the needle is withdrawn. Do not massage the site. Do not recap the used needle. Engage the safety shield or needle guard if present. Discard the needle and syringe in the appropriate receptacle. Assist the patient to a position of comfort. Remove gloves and dispose them properly. Perform hand hygiene. Evaluate the patient's response to the medication within an appropriate time frame for the medication. Document the procedure into the patient's chart.